Ladies and gentlemen, boys and girls, the award-winning Great Indoors is proud to come to the fabulous Las Vegas Convention Center, MWC 2022. Baby, let's make it amazing.
Thank you, Frank. Yes, this is season 5 of TGI, and here in Las Vegas, as the GSMA's official podcast, I am joined by a multitude of incredible guests from across the industry. I'm not forgetting also my producer and co-pilot, Larissa Yee. Now, this is the 4th episode of the incredible conversations that we captured at North America's biggest telecoms and technology show. And I was really proud to be joined in this particular episode by guests who are making huge strides in the world of IoT, Internet of Things. We have Bryan Lubel, who is the EVP of Connected Health at Core, and a fellow Brit, Steve Statler, who is the SVP of Marketing at Wiliot. Now, Wiliot are doing some incredible stuff in this domain, and we will be talking about ambient IoT amongst other things. Now, the vaults forward in IoT in the last couple of years have been incredible, driven specifically in many instances by the pandemic. So these are fantastically insightful conversations. So buckle up and let's get started. Okay, so my next guest on the Great Indoors here at MWC 22 in Las Vegas is Bryan Lubel, who's the EVP of Connected Health at Core. Welcome to the Great Indoors.
Well, thank you for having me. I appreciate you having us here.
Yeah,
thank you.
It's great. It's great to have somebody back from Core because you guys were in Los Angeles last year and we spoke with your CEO and we had a great conversation. So just for our listeners, give us a background on, a very quick overview on what Core is doing, what's happened in the last 12 months, and more specifically your role as the EVP of Connected Health.
Sure. Well, let's start first with kind of a broader view of what's happening with Core. So Core continues to put a real strong focus on helping enterprise customers adopt IoT technology and try to simplify what is a very complex process, right? There's a very complex ecosystem. It requires a lot of players. It requires organizations to either find a robust set of partners to help them implement, or to bring in so much internal subject matter expertise that may not be their wheelhouse in the business that they're doing. And that kind of translates to what we do in Connected Health, which is our customers in Connected Health, their focus is on making patients' lives better, improving patients' outcomes, helping them live with chronic diseases and have a more fulfilled life. And so that's where really their expertise is. Where their expertise is not is how to IoT enable, or how to make the collection of critical data coming back to monitor those patients and their progress. That's not what they live and breathe for. So we try to become that subject matter expert and help them do that across the globe.
And your customers are the doctors, the hospitals, etc.
It's a broad range. So typically our traditional customers have been medtech, medical device manufacturers who want to IoT enable their therapy or their solution. That's expanded into companies that focus on really unique value in remote patient monitoring, because there's a lot of value to add in terms of helping what we call provider networks, or the doctors that we all go to see on a day-to-day basis, helping them use this data in a meaningful way. So just getting no doctor wants to see 62 blood pressure readings from Bryan Lubel a day. They want to see some interesting kind of synthesized information about how I'm progressing with the disease state, and if my blood pressure is raised, are there other factors that maybe require them and their care delivery team to intervene and help me avoid a crisis, or help me avoid getting worse. And so there's a whole suite of companies out there that do analytics, that do workflow optimization, care delivery optimization, patient engagement, just getting patients engaged with the process to help bring the cost of healthcare down, right? And then other types of customers that have really been growing for us in the last 5 years are pharmaceutical sponsors and what are called clinical research organizations. These are the people that run clinical trials.
Right, yeah.
And be really interesting to chat with you and tell you about what's happening in that space as well, because it affected all of our lives in the last 3 years with the COVID pandemic.
Yeah. So let's talk about what's happened since COVID, particularly when we talk about IoT adoption. And when we, speculate on how it can look in the future, we talk about replacing doctor surgeries with data centers, and like you said, doing the analysis, doing the proactive care and the proactive measures. You know, we all have our smart devices now that are taking our blood pressure, the sensors that are monitoring us constantly. So how does that play into your model, and also how have things been propelled because of the pandemic? Because obviously I think that was an inflection point, because people were in many different fields, but particularly in remote healthcare, that was something that became a real thing during the pandemic. So
Absolutely.
has that been a big push?
It has. So pre-pandemic, connected health was already on a pretty aggressive growth trajectory. We were seeing that because, and there were two main drivers, which should always be, well, the one main driver that should always be number one is improving patient outcomes, improving patients' lives, because you can treat them more effectively and you can guide them more effectively. The second piece, which is important, it's really important, is how to help control the cost of healthcare, because if healthcare continues on the cost trajectory that it's on, it will become unaffordable for the vast majority of people, unless you're just ultra wealthy and can afford that delivery. So we have to find ways to bring the cost of healthcare down. Now, the pandemic introduced some really interesting dynamics for both healthcare delivery as well as for this other area I've been talking about, which is clinical trials. And first, we all know how overwhelmed the healthcare system became in the first year of the pandemic, and that our healthcare delivery teams were exhausted and overworked, and it just became something that they couldn't absorb any more volume. Just as importantly, there were people that didn't have COVID but had other very serious health afflictions that couldn't get healthcare because, number one, you don't want them anywhere near a healthcare clinic that is overwhelmed with COVID positive patients in the early days of the pandemic. And number two, just the health system couldn't accommodate them.
And number three, I think from a cultural perspective, people deferred care because they just
didn't want to go out of their house.
Yeah.
Exactly. And so so there's many different subsegments in connected health. We saw a huge acceleration of what's called telehealth or telemedicine, which is the IoT enablement of a doctor communicating directly with you, or at least some form of care personnel, whether it be a registered nurse or a physician's assistant, to be able to have an interaction with you. And in the very beginning, it was just simply a teleconference where they could talk to you and hear about your symptoms. And then technology continued to intervene, and things, being able to, maybe you have a lesion that you want to hold your camera from your smartphone to, so that the doctor can see it. So basic things that started to accelerate. At the same time, in the drug trial business, so we went from, in 2017, there were 278,000 registered phase 3 drug trials in the world. And this year, we're approaching 700,000 registered drug trials. Having the traditional way to deliver a drug trial is to have study participants come into a clinic to get enrolled. Well, you don't want those people coming into a clinic that's overwhelmed with COVID. And so there was a real, very accelerated migration, this inflection point you're talking to. How do we get people into drug trials and start the therapies and monitor them closely without having them come in and meet clinicians in a clinical environment? And so we had to be able to do that in a decentralized way, give them kits and technology so that we could capture that data remotely.
But and there was a time issue here to do this. If you look at the COVID things, it was a race against time as well as a change in process, right?
Exactly. So if you look at a traditional drug trial that does not use what we call EDC, electronic data capture, if you look at a drug trial in general, phase 1 of a drug trial is where they give the experimental compound or the experimental therapy to a perfectly healthy, normal person that has no disease state, to make sure it does no harm or damage. Right? Phase 2 of the drug trial is in a very, very controlled environment, typically in hospital and clinic. You're giving that same drug or therapy to someone who does have the disease state, but again, you're making sure that it does not do more harm than good. They're doing measurement on the efficacy, but you're really doing it in a controlled environment.
Right.
Phase 3 is the very broad trial where it's just before commercialization. You're trying to get data. They're typically something called a double-blind trial, where the study participant does not know if they have the real therapy or a placebo, and the doctors who are administering it don't know if it's the real therapy or the placebo.
Okay.
So you have basically a completely anonymous, test in terms of, is this therapy really impacting
Yeah, yeah.
the disease state. That's the phase that we typically get engaged with. That's the phase that we were all waiting and anxiously waiting for with the COVID vaccine. If we followed the original drug trial path and timeline without this IoT enablement and electronic data capture, that's typically a 2.5 to 3 year process, which means we would be just getting the first versions of those vaccines now.
Yeah, yeah.
Millions of people would have died that didn't, because we were able to accelerate that. And when I say we, I'm certainly not speaking about we meaning core. I'm talking about we,
the industry.
The industry was able to really respond to that.
Yeah, and that's fascinating. And as that precedent of expediting the process to market, has that become the new normal, as it were?
I think the COVID vaccine was a little faster. So first, certainly they were authorized under emergency use first, which typically you don't issue an emergency use. You wait to finish the complete trial. You wait for all of the final data to come in. But we couldn't wait. I mean, as a human race, we couldn't wait because we were seeing such huge fatality rates with this virus. But yes, we're seeing two things happen in clinical trials. So this migration to decentralized trials where study participants don't have to come in to the clinic and can still participate and get very accurate data validated with the protocol of the trial. That used to happen in serial, not in parallel. So you basically would collect the data in the trial, then you'd go back and send a validation team out to make sure the data was collected in the proper protocol, and then you'd bring that data back, analyze it. That could take 2 to 3 years. And so we're seeing that really get compressed now. And it's really good for you and me, because we're seeing drugs that really change our lives get to market much quicker.
Absolutely.
And still safely.
So, I mean, that's the fantastic examples of how the industry in this domain has shifted to face the circumstances of what was happening. What do you see, Bryan, moving forward? What's your predictions now for connected health between the next 12 to 24 months? Things are moving so quickly.
Oh, yeah. So first of all, enabling connected devices is a huge trend that's continuing to accelerate.
Right.
So where we saw a heavy focus on remote patient monitoring for chronic disease management and getting you and I things like a blood pressure monitor, a pulse oximeter, a weight scale. Now it's expanding into more technologically advanced sensors, motion sensors that are very precise. So for example, they can measure the effects of a drug on Alzheimer's or an MS patient, balance, gait, and walk. I'm talking something much more sophisticated than an Apple Watch. I'm talking things that measure very, very precise movement.
Right.
ECGs, EKGs, drug delivery systems. So neurotherapy, where you may have a chronic pain problem and you need to have very tightly monitored delivery of pain medication through an injection pump, that now can all be IoT enabled to make sure that you're not overdosing, to make sure that you're not, that you're getting the effective pain medication to manage that for yourself. So that's one area where we're just seeing connected sensors explode. The challenge for the industry is going to be what to do with all that data, how to use it in a meaningful way. And then the second side of this is just the ubiquitous speed and bandwidth that we're starting to see. So when you get into 5G is not necessarily as impactful on things like chronic disease management for monitoring a patient, because you don't need that bandwidth and speed. But let me give you a scenario of a use case where you do. So a type 1 diabetic today many will have an insulin pump, and they'll have a subdermal continuous glucose monitor where they have a sensor in their skin, and that's continually monitoring their glucose levels, and then they have to dose themselves with the insulin pump based on their knowledge of how their body, for let's say you're in your 40s, how does your body for the last 20 years, based on what you ate today, how much you exercised, give yourself the correct insulin dosage. Well, imagine having ubiquitous high bandwidth connectivity where that insulin pump now has access to your entire history of how your body has processed insulin and glucose, and now it's connected to the cloud, and it can give you much, much more detailed insight into how you should be dosing for your next dose.
Or it could even potentially do it automatically, right?
It could, and you know, there's that. We're going to get there. That's the question of who's ready for that, right? Like who's ready for autonomous airplanes? Are you yet? I'm mentally not. I know the technology's there.
I'm going in an autonomous car later on with Halo. We're going to do that, and I'm like this. Yeah, it is that point of trust, right? Where. But you made me think of something, Bryan, that I think is really interesting, and it was something I saw. So we can't go anywhere without hearing about the metaverse, right? And we talk about metaverse use cases around education, gaming, shopping, But I was at an event in Seattle in September, Chetan Sharma's Mobile Future Forward event. And I'll give you the name of the startup. It doesn't come to my mind right now, but they put on the Oculus headset, and with a 5G less than 10 millisecond latency, we're demonstrating remote surgery on a patient.
Robotic surgery.
Yeah.
Right. And so I have some good friends in healthcare that volunteer. They're surgeons, and they volunteer, and they end up getting on planes and flying to third world countries and areas that are economically depressed as a charitable effort to offer improved healthcare to people that normally don't have access to it. So imagine with ubiquitous 5G networks now, where you don't have to get on a plane, and you've got a patient somewhere in sub-Saharan Africa that needs a critical surgery, and there's a very specific expertise with surgeon that has it available. With robotic surgery and that speed of communication, I think we're going to see that start to happen. Robotic surgery is real today. It's just a question of the surgeon standing next to the robot in the room with you, and 5G enables it to be potentially remote.
Exactly. Bryan, I've really enjoyed our conversation.
Me too.
On this particular topic, I could talk for hours, because again, it's one of those, the benefits of it to society and humanity are just incalculable, really. They're so positive, and I think that's one of the things that we see at this show, is that the tech for good, not just for dollars and cents. Yeah, the dollars and cents helps, but the tech for good, and what the new industrial revolution and all the technologies that coalesce around 5G. It's really inspiring, right? It must be. Your job must be very enjoyable.
And when I got into, back when I got into this, we called it M2M, not IoT, right?
Yeah, exactly.
And it was an intriguing area for me. And as soon as I really started to get deep into healthcare, it was very quickly that I realized the real impact this was having on patients' lives, right? And I just heard a story last night. One of our ecosystem partners is making a automated pill dispenser that helps seniors. Some seniors take 13, 14, 16 pills a day. And I found out that the founder of this company lost his mother because she mistook her pills for a particular condition. It was a very simple thing that if she had but she didn't have the guidance. She was elderly. She had early onset Alzheimer's, and without a device like this, it became really problematic. It was like Russian roulette. Was she taking her meds the way she should? Yeah. And this inspired this gentleman to kind of make a student body left move in his career and go develop this solution, because he saw what it could do to really impact somebody's life.
Wow.
So when I see us playing in that space and having that kind of impact, I wake up every morning energized and really excited about what we do. Not that I wouldn't normally be in business anyways, but
there's that extra factor.
It's exactly.
Great, right, brilliant. So Bryan, do you know how we finish now? We finish with what we call our TGI to go quickfire round.
Okay.
I'm going to ask you 5 questions, multiple choice. You have 2 options, and you just state your preference. Okay. And it just helps our listeners get a better insight into your personality. And it's a bit of fun to finish.
Sure.
Okay, so you ready? This is TGI to go. TGI to go. Question number 1. Frank Sinatra or Dean Martin?
Dean Martin.
Okay. Everybody has said Dean Martin today. Everybody
we're
said
in
Frank
Vegas.
Sinatra. Yeah. I'm going to tell Larissa as well. She said nobody's heard of Dean Martin, and I was like, what? Anyway, there we go. Blackjack or roulette?
Blackjack.
Yeah. And are you going to have an opportunity to?
Played a couple times. Went up once, $200. Went down once, $200. So what I do is when I come to Vegas, I put a specific amount of money in one pocket.
Right.
And when it's gone, it's gone, and I move on.
That's very sensible. That's very sensible. New York or Los Angeles?
New York.
Yeah. I think that's self-explanatory. Coffee or tea?
Coffee.
Mm-hmm. And this is why I don't know why we're asking people this question, but it has elicited some interesting answers. Singing or dancing?
Singing.
Yeah.
Not that I'm a singer, but
Are you in a band or anything?
I was in a brass band, not a
okay.
singing band. Growing up, and spent a lot of time in that. It was in the Ohio State University marching band, which was one of my proud moments.
Yeah.
But those of us who like to fancy singing, thinking we can sing, I can carry a tune, but you don't want to hear much beyond that.
Well, brilliant, Bryan. I've really enjoyed our conversation today.
Likewise,
Thank
nice
you for
to
being
meet
a
you.
guest
Thank
on the
you.
Great Indoors.
Thanks for having us.
Okay, so my next guest here on the Great Indoors at MWC 2022 here in Las Vegas is a fellow Brit, Steve Statler from Wiliot. Steve, welcome to the Great Indoors.
Oh, it's a great pleasure to be with you in this wonderful environment you have here in the heart of MWC.
Yeah, wonderful, wonderful. Right, Steve, so give us an overview of what you do at Wiliot, because we had a little bit of a chat before about it, and it's quite fascinating. What's the elevator pitch, if you will, in 2 minutes?
Very good. So Wiliot is a cloud software company, but we also are a semiconductor designer, and we give away the chip designs and sell the cloud software. But it all sits on this thing, which is basically a postage stamp sized computer that powers itself by harvesting its energy from radio waves. So it's a battery-free Bluetooth device. And as I say, it's sticker-sized, and it has got an ARM processor in it. It can sense things like temperature and fill level, dilution of the things that the sticker is nearby, and then it communicates with phones and other Bluetooth devices. And what we're doing is connecting every single thing to the internet, not just the old world of cars and shipping containers and appliances, but the things that are inside the shipping containers, cars and appliances, food, medicine, clothing, everything.
It sounds amazing, and well, for so many different reasons. So give me a real example of what this will enable now, because we talk about IoT frequently, we have done for years. We're right in this new revolution of all the technologies coalescing around 5G. But this innovation in itself is fascinating. But give me a real use case, how that would manifest itself in this new world.
I'll give you a couple. So one, your podcast started when COVID started, and one of our use cases was actually triggered by a customer of ours, one of the large pharmaceutical companies, who wanted to be able to track and trace COVID vaccine vials.
Okay.
So shipping, lots of them, that's all done with conventional IoT devices, the cryogenic chambers.
Mm-hmm.
But what about that vaccine vial when it gets taken out of the chamber and it goes from the refrigerator to the clinic and gets in the hands of the nurse? Has it been left out in the sun? Is the vaccine actually going to do its thing? Or has it been left out in an environment that will mean that it actually does you no good at all? And so the challenge that they paid us to respond to was integrating our postage stamp tag and actually making it small enough to wrap around one of these vaccine vials and to measure the temperature, but also the fill level and whether it had been diluted properly, because you want it to be diluted before it goes into your arm. And so we did that, and that's one of the projects that I'm most proud of. It's an amazing thing. Mm-hmm. It's one that hasn't really scaled for reasons that I'll come to, not because of our technology, but because of the ecosystem. That's why it's exciting to be here talking about the prospect of this technology, ambient IoT as we call it, becoming part of the future of the technology that everyone in this conference uses, 5G and 6G. So that's one use case. And I want to talk about another one which is scaling, which is in a way less exciting, but also very potent, which is putting these stickers onto plastic crates that are used to take produce, zucchinis and tomatoes and strawberries from farms into stores. So basically farm to store, cold chain. And what we do is we just allow a conventional plastic crate to become smart and connected. You stick these stickers on the crate, and suddenly it's like turning the lights on, and you can suddenly see all of the crates all of the time, their entire path. And the reason why this is taking off is that the ROI is like trivial to calculate. You can have, rather than having to buy 5 million crates if you're a grocery store, you can buy 4 million because you know where they all are.
Right.
And you can manage where the pool more efficiently. Also, you can stop them getting lost and disappearing. So that's one of the problems with these more sustainable plastic crates, is they cost more, and when you lose them, that's costs more money. But the unexpected benefit, so that was kind of like the table stakes, here's how we get the project off the ground. What we found was not only can you monitor the crates, but you can monitor what's in them. So you can start to get visibility on the state of the perishable products, and you can take a supply chain that the retailer in this case thought that it was a 3-day supply chain, and sometimes it was actually taking 6 days. So when strawberries take 6 days rather than 3 days, you know what happens. They're not looking so good, they're not tasting so good. You get them home and you're kind of disappointed. So by tracking the crates, you can see, oh, there's like 30 crates that have been stuck at the back of that packing shed, and this FIFO, first in, first out, it's actually turned into a LIFO, and stuff's going bad. And we enabled Israel's largest retailer, a company called Shufersal, to spot that, to instrument their cold chain from farm to store. And now what they're doing is they're moving from first in, first out at the store to ripest first. So when crates of produce come in the back of a Shufersal, if one is actually riper, they can push that out and get it sold and start to eat away at this terrible problem of food waste, which is a big part of what's afflicting the planet. 40% of food is wasted before it gets to the store. So those are 2 use cases. There's the vaccines and the produce, but there's so many more, many more.
No, but I think it follows the theme of what we talk about on this podcast. And you pointed to 2 really great examples there of technology making a significant impact on some of the biggest societal challenges we face, right? And the food one I think is really interesting. We're members of the 5G Open Innovation Lab. We were part of the food resiliency project in Snohomish County in Washington. But we looked at the food crisis, and like you said, the amount of food that just perishes before it can get anywhere. And this is a clear example of where this can streamline supply chains and prevent that awful waste that's happening. It's a great example.
It is cool, and that's one of the things that's driving our growth at the moment. And Wiliot as a company, we're very fortunate. We have amazing investors: Verizon, NTT Docomo, SoftBank led a $200 million investment round at the end of last year, PepsiCo, Qualcomm. So our challenge is not, is this technology interesting and disruptive? It is. It's how quickly can we get this to realize its full potential. And in a sense, we have a problem, which is we're highly differentiated and novel, and we've recognized that that's actually slowing down the adoption of this technology, because we're relying on partners to apply this to so many other use cases, but it needs momentum. And that's why we're super excited to be here at MWC, because it marks the start of another odyssey in this telco industry that we're all part of, which is 5G and 6G embracing ambient IoT and having some of this technology actually integrated into the stack that will make it much more pervasive. So for Wiliot, it's a very important time. We're sort of giving up some of the novelty. We're contributing our technology to that standards effort.
Yeah.
But yes, there'll be more competition, there'll be more choice, but we think that things like that vaccine vial use case that didn't scale because it needed hospitals and drug distribution companies to all get the infrastructure in place, that gets so much easier when it becomes just part of 6G.
Yeah. So let's talk about, I love that term, ambient IoT.
Yes.
And the first time I heard it was when we spoke before.
Yes.
Steve. Is that is that come from you? Or is that
Well, we've been
an
using
acknowledged term?
It's
right
an acknowledged term. Ambient computing, ambient IoT. These are actually terms that are now being used by 3GPP as they debate what's going to go into release 18 and release 19. So, yes, it's one that we've been talking about. But it's worth unpacking. We see ambient in two ways. One is ambient in terms of a power source. We don't have batteries. We're harvesting energy from ambient sources like the radio waves that surround us. We can harvest energy from phones, from the telecommunications, from the cellular signals, as well as from the Bluetooth signals. So that's one half of ambient. It's getting power from everywhere. But the other half is putting intelligence everywhere, starting to put these computer connections into every single thing, so everything becomes connected. And that's going to take our industry from an industry we measure in billions to trillions, because the tags are going to be literally in the furniture. One of our customers makes furniture, and they want tags to know how many chairs there are in a meeting room and whether people are sitting on them, and helping with the recycling of them so you know what's in the chair. So it'll be in the furniture, it'll be in the wallpaper, it'll be in the care label on your clothing, so that your washing machine will know that you've got red shirts and white shirts in the same load, or it's at the wrong temperature. It'll be in the refrigerator looking at the Tupperware, knowing that you've got food that's going to be going off soon, so here's a recipe for using it up. That's the really interesting part of ambient is not the power technology, it's the power of the internet everywhere to solve the big problems around supply chain efficiency. How you and I get to cash in our pension check. We need more efficiency and productivity. And the last thing is climate change, where this can have a massive impact.
I've always remembered, because IoT to me is always an evolution of M to M, right? Where we were, and we have been there, we always talked about smart meters and power, and the economics of it were always a little bit. Is the environmental climate change piece that based on ambient IoT and your technology being completely independent of any power source, or are there other elements that can add to the climate change?
So yes, it's that. This is a much more sustainable way of getting connectivity, is getting rid of the batteries and reusing the energy that surrounds us. If we could see the radio waves around us, this would be like a Technicolor. It would be like we were on LSD or something. We'd just be seeing color everywhere.
I've seen that before, because we did a video back in the day where we said if you could see it, and we put it in the video, and it's crazy, right?
Well, come to our booth, because we're actually using augmented reality to superimpose the data from our tags, and you can see the color of the tags as they start to broadcast in the temperature. That wasn't a plug.
You're allowed to plug. Honestly, plug away.
The important point is about the environment. So you were asking, is it beyond just a more sustainable IoT edge node? And it is. It's really, there's three things that we can do to make a huge difference in terms of climate change. One is moving to dynamic real-time carbon accounting. The LCAs that are part of what the ESG heads are doing. Everyone's having to measure their carbon footprint now. Thanks to the SEC rules that just went into effect, thanks to the EU rules, every company is going to have to know what its carbon footprint is. And people are panicking, right? And they're trying to get their annual audit of what our carbon footprint is. But that's not good enough. We need to have real-time carbon accounting. If we're going to make progress and really hit and exceed these deadlines and avert disaster, we've got to know what the carbon footprint is in real time, and give that data to everyone, not just the ESG head, but the guy that's managing the truck scheduling, the lorry scheduling, the delivery scheduling of products. And he can say, oh, we've got I can see that we've got the coolers on the containers that are sitting out the back of the store, and our carbon footprint's going up. And because I've got tags on everything in there, I can see what my carbon footprint is in real time. So that moving from annual to real-time carbon accounting is thing number one. that's going to help save the planet.
Yeah.
And the other things are just related to efficiency. If I can see everything in the supply chain, and I can see that there's a stack of strawberries that's on the shop floor that hasn't been put in the cooler, and I can let the store manager know, then I can make the supply chain more efficient, and I can basically spot problems. That's the second thing. And then the last thing is something called demand chain, which is another term that we didn't make up, but we're using it a lot more than most, which is giving companies that make things visibility of inventory at the shelf level through the wholesale channel. So if I make car parts, I might have 100,000 distributors around the United States. If I don't know what my inventory level is in those, then I basically have to make twice as much as I would do normally, because I'm just stuffing it through the channel. If someone turns God mode on, back to the computer simulation thing, and I can see everything everywhere, then I can make a lot less of my car parts, because I know that I'm not out of stock in 50,000 of these outlets, and I don't just have to brute force shove things through the supply chain. So that demand chain intelligence also means that I can use smaller trucks.
Yeah, exactly.
I can go more direct routes. I don't have to do a milk round. I can just send to places that are out of stock. So that's very important that we need to do with this technology. And I'm really pleased that 3GPP is embracing it, and they're moving forward faster than we were expecting in adopting it.
Well, look, Steve, I really enjoyed our conversation. And what I think was so poignant about your last point you made there is, I always ask people, if technology could help us overcome COVID, help bridge the digital divide, can it ultimately help solve the biggest problem facing humanity, which is climate change? And you just gave me the first ever clear, real, tangible reality of how it can do so. So I think that's incredible.
Yeah, and the great thing is everyone in this ecosystem can help. Let's move forward. Let's share the technology. Let's get ambient IoT integrated into the phones, into the base stations.
Yeah. Brilliant. Well, Steve, look, I really enjoyed our conversation. We now finish with our TGI to go round, which is quick fire multiple choice.
Okay.
All you have to do is give me your preference.
All right.
Okay, TGI to go. TGI to go. Question 1. Frank Sinatra or Dean Martin?
Frank Sinatra.
Okay, that's great. He'll be here at 3 p.m. by the way. That's amazing.
His spirit.
A British question for you here. Fish and chips or curry?
Oh my goodness. Curry. I love both, but Friday night was always curry night in our household when I lived back in England.
And where do you live now in the US?
In San Diego.
In San Diego. Is there many good Indian restaurants?
There are. You have to look for them though, and every time you go in and you say I want it hot, they give it to you anemically unspicy because they look at you and they're like, this guy can't take it. Whereas in England you'd get something that gets the endorphins going.
Slots or roulette?
Roulette.
Yeah.
It's got more style, it's more of it's a team sport, you know.
Liverpool or Manchester? I've just put that one in there. It's another British question.
Wrexham.
Ah. I'm from near Wrexham.
Oh, really?
Yeah. But
Amazing
you've been
show.
watching the
Amazing show.
Yeah,
it's just, I can't, I'm rooting for them. Rooting for them.
Brilliant. Running or kayaking?
Oh, I like both. Kayaking is, San Diego's got some great waters, so I do kayak occasionally.
Excellent. Well, there we go. That finishes the TGI to go round, Steve. I want to say thank you very much for joining us here at the Great Indoors. I hope you enjoy the rest of the week. What are you, apart from what we talked about there and the chat you have tomorrow, what are you looking forward to seeing here, or what you're hoping to get out of it?
I'm just looking forward to having more conversations like this, maybe not on the air with so many people listening, but just with other people in this ecosystem. For us, it's a new ecosystem. We've been talking to the Bluetooth ecosystem, which is great, but the cellular ecosystem is just an amazing group. We can really make a difference as a group, so I'm looking forward to more conversations about how we can partner and collaborate and just getting the word out.
Brilliant. Well, thank you very much again, Steve, and enjoy the rest of your week.
It's been a privilege and a pleasure.
Excellent. Yet another great conversation from here in Las Vegas. So stay tuned for more, and also check out amdocs.com/The Great Indoors for more information, back episodes and videos associated with TGI. I'm Matthew Roberts here in Las Vegas for Amdocs. See you next time, wherever you are.